So you're getting a few more people logging in. Good afternoon, everyone, and welcome to another one of our sessions for the bi-monthly webinars. And we bring these webinars to try to connect people, all professionals, carers, and those who work within the unpaid carers work streams. Just a quick housekeeping to say you've all been placed on mute. If you're on mute, can you please go on mute? This is basically to say the session is being recorded, and it's to avoid any background noises during the recording as well. If you have any technical difficulties during the session, please do drop me a message in the chat box. Today we have Cuddy, who's from Carers Collective, who will be sharing their program. And I'm very excited to welcome Cuddy to this session today. She's been messaging me for the past months, probably more over a year, to say, Steve, I need to come to one of your sessions. So it's a pleasure to welcome Cuddy today. We will have 15 to 20 minutes after Cuddy's presentation, where people will we'll have time to present any questions that they have for Cuddy. But in the meantime, any questions that you might have for Cuddy or any comments during the presentation, please just drop them in the chat box and we'll be able to pick them up when we go through the questions. I hope you enjoy the session and welcome to Cuddy. Cuddy, all up to you.
Good afternoon, everybody. Thank you for inviting me to your to present to your bi-monthly lunch and learn. So, Steve, could you put my first slide up, please?
I'm just sharing the screen now, Cuddy. Can you see the screen?
Beautiful.
Okay.
Next slide, please. So, oh no, back again. So my name is Cuddy Thomas, and I am the founder of Carers Collective, which is a registered charity, newly registered charity. Next slide. So whenever I do be a keynote, in fact, I think this is the first webinar that I've presented. Whenever I do a webinar or a keynote speak, I always like to kind of give you a bit of a backstory. So I'm 56 years of age. I'm an unpaid carer. I'm an unpaid carer to my son, Elijah Hodges, who is 18. Now, giving you a little bit of my backstory is that I was born in 1968. I'm indeed a Brummie, so I was born in Birmingham to a mother of African heritage, and she was 22. Not sure whether or not she was a single parent. I'm not sure whether she was married, but she was 22 years of age and she gave birth to me. Now, back in 1968, they didn't know much about the rare condition called Apert syndrome. But that aside, not only did they not have much information about Apert syndrome and the effect of Apert syndrome, but they labelled me. In those days, they used the word severely retarded. Obviously, however, nowadays it would be somebody with severe learning disabilities. Now, because I had that label and because my mother was in this country, I guess it would have been a shock to the system, obviously giving birth to a baby who had physical disabilities, but also then being told that I was going to be severely retarded. Well, I don't know how she would have coped or even dealt with hearing those words. So at the age of 1, she up sticks and left me to it, I guess, because she couldn't cope with the thought of bringing up a child who was not only going to have physical disabilities, but was also going to be, as I've already shared with you, severely retarded. So I was left, basically abandoned. And I spent the first couple of years in a hospital for children with profound learning disabilities. And then I moved to a residential children's home. And so I'm still in the Midlands at this point. And the residential children's home was called Sunfields Children's Home, which is just outside of Birmingham. And as I was growing up in Sunfields, obviously the matron discovered, well, it became very apparent that mentally I was of sound mind. Um, with that, I then got transferred to the care of Birmingham Social Services with the view of being adopted. The adoption fell through because my prospective adoptive mother um, was involved in a car accident, so unfortunately that broke down. I then got fostered. That broke down after a couple of years because my foster father at the time sexually abused me. So then I moved out. Obviously, I couldn't stay in the foster home once I kind of shared that information. So I then moved out of that foster family and moved back into residential care. At the age of 16, I moved to what would be called, I guess, a hostel to prepare young people for adulthood. Being the strong, fairly confident, no, I am very confident, I have to say. And even at that age, even at 16, 17, I thought, well, I'm ready for independence. What do I need to learn about living independently? So I declared myself homeless and got a council flat on the fourth floor, high rise. When I moved into this council flat, I then thought, I am so not ready for independence. Spent a year in the council flat, and then I moved out of the council flat into a shared house. So that's just gives you a bit of a flavour of my backstory. Um, I did various jobs. I did a YTS scheme. I wanted to become a chef, so I went to a catering college. I started out in the restaurants, then went into the kitchens, hated the kitchen, so I went back out into the restaurants, became a qualified waitress, and then I started working for an organisation called St Basil's, which is a charity, a homeless charity in Birmingham. And I guess you could say I went, I found what I've been looking for, working with homeless young people. In fact, they were homeless young men because I was working out of a men's hostel at the time. 5 years into being a support worker for homeless young people, I got burnt out basically, and went off sick, and then came back to work and said, obviously I don't want to leave this organisation, but I cannot physically work directly with homeless young people anymore. It wouldn't be fair on them, and it wouldn't be fair on me. So I then became a receptionist for the organisation and got told off for talking too much. Um, I don't know why that was. But anyway, as a receptionist, you're supposed to talk, you're front facing of the organisation that you work for. Anyway, so I was with St Basil's for a total of 10, around 10, 11 years. During my time at St Basil's, I then became pregnant with my adorable, beautiful son, Elijah. So Elijah was born in 2006, March 2006. Um, he was born with the condition called, which is the same condition that I have, which is Apert syndrome. Apert syndrome I used to say Apert syndrome is a defunct gene that affects the growth of the bone. So often our skulls are misshaped. We have fused hands and feet. But as I've matured in age, it's a little bit more, I'm discovering it's a little bit more complicated than that. So Elijah was born with Apert syndrome, cleft of the soft palate, and a heart murmur. That was it. Then he obviously, as he kind of developed in age, He then had to have surgery. On his first surgery that he had was on his hands, and then he had what we discovered very quickly. I guess when he was about maybe when he was about 8 months old, we discovered after having an MRI scan, we discovered that um, his skull was misshaped. So then he had surgery. Surgery was a success because it expanded his skull. I would say the aftercare was not so great. And as a result, I guess, of not being listened to, Elijah became brain injured, severely brain injured. And that turned our lives upside down. Elijah went from a young child who was going to nursery because I went back to work after 9 months. He was going to nursery, he was eating orally, he was kind of beginning to crawl, and then bang, he became brain injured. And I became a full-time unpaid carer. Now, at the time of brain injury, I was still working at St. Basil's. Um, and I stayed in employment, but obviously I had to go off sick. Elijah spent 10 months at Birmingham Children's Hospital, and then we moved down to a place called the Children's Trust, which is a trust in Surrey, where we spent from August 2008 to November 2009. I would say during that time he probably spent a good proportion of that time in hospital because his health was so unstable. So that leads me on to, why did I set up Carers Collective? Well, let me take you back 9 years. Um, 9 years ago, after several years of chewing the ear off my local, so basically went down to Surrey, and then we moved to the southwest, um, um, North Somerset. So 9 years ago, after several years of nagging and communicating and sharing that I wanted a personal health budget for Elijah because traditional support was not working for us. I set up, no, I didn't set up, in 2015, we successfully got a personal health budget for Elijah. Now, I have to say, the whole personalization agenda and personal health budget and personal health and personal budgets are an absolute godsend to carers out there that are confident and have the skills and resources to manage. So in getting this personal health budget, Elijah at the time was in Bristol Children's Hospital because he needed a tracheostomy. So 3 years into care managing, I became far too emotionally involved in the workforce. As an unpaid carer with a personal health budget, you kind of like you almost like I don't know whether expected or it's I think there's an expectation that when a family get a personal health budget, we walk into management. The only challenge with that is that we don't have a line manager, we don't have regular supervision, we're not given training, we don't have a personal development plan. So we kind of learn on the job. So for the first 3 years of me being a care manager, I became too emotionally, got too emotionally involved with the workforce. What do I mean by that? I listened to their problems. I took their problems on board. I tried to problem solve for them. I was, any request that they had, I said yes. I didn't have any clear boundaries with them either. So 3 years into that, and this is, dealing with my own healthcare needs and that of Elijah's. And in the early years of us having a personal health budget, his health was unstable, so we were ping ponging in and out of Bristol Children's Hospital, and also Frenchay, which was where the neurosurgery team were based at the time. So 3 years. So we're going 3 years in. I thought, oh, I can't do this anymore. I can't keep saying yes to the care team. So Elijah, because of his healthcare needs, he needs 2 to 1, 24/7. I can't keep saying yes to the team. I can't keep just plodding along with no clear boundaries with them. And I certainly can't continue being emotionally involved in the workforce. So I said to Health and Social Care, right, I need a coach. Now, I didn't know what a coach was or did at the time, but all I knew was I needed a coach in my life. Unfortunately, or fortunately, I don't know which way you want to look at that, Health and Social Care said, no, you can't possibly take £250 out of Elijah's personal health budget to be coached. So, being the woman that I am, I then went, well, I know what I need. And so I went and self-funded a coach. Now, I have to say, being coached as an unpaid carer who is also a care manager was an absolute game changer. It gave me the tools and the resources to manage effectively. I stopped becoming emotionally involved in the workforce. I was no longer a yes manager. If they had a request, I would say, I need to think about that and get back to you. I set boundaries in place. I also communicated with the team what I expected of them when they came in to the to the home to support my son. Um, it was an absolute, yeah, as I said, as I've already shared, it was an absolute game changer and did me the world of good. I have to say, I'm a different woman as a direct result of being coached. And actually, Tamsin, who's my coach, still coaches me to this day. So that leads me on to why did I set up Carers Collective? Well, as I've already shared, being having Elijah, who's my 18-year-old son, who has a personal health budget, and as a result of that, I care manage. I kind of went, well, how many more carers are out there doing what I do, but without the external support? Next slide, please, Steve. So I set up Carers Collective because I want carers to be equipped to be able to manage. So we manage, we multitask, we plan, we liaise, we facilitate, we organize. We have to multitask, we juggle, and without that training, I would calculate out of the number of people that are on this webinar today that there is a percentage of you that work, and those of you that are in employment will all have a line manager. You'll all get regular supervision, and you'll probably all have, I would hope, personal health plan, personal development plan. Can't get my words out. A personal development plan, and you'll be sent on regular training. So So anyway, I am advocating for carers to have the resources and the skills and the knowledge to be able to manage effectively. And being coached for me is not just about, you know, kind of the work element. There's a work element and how you navigate and how you manage that, but then there's also the personal element of how do we communicate with paid healthcare professionals or social services therapists without getting angry or frustrated, because 10 years ago how I communicated was by swearing, by raising my voice, by shouting. And the problem with that was the behaviour got judged and the message got lost, which is another good, which is another really good um, uh, skill that I've learned by being coached, because I now communicate Elijah's needs calmly, considered, clearly. So whoever I'm communicating to hears the need and then can respond appropriately. So Carers Collective, as I've already shared with you, is now a registered charity. It didn't start off as a registered charity. It started off by me going, right, what do other carers out there need? So I collaborate with an organisation called Inspired to Change, and a lady called Carrie and a lady called Dawn currently deliver our Building Resilience and Wellbeing programmes. Now, in the early days, so 3 years ago, when we developed these programs, I used to call them solution focused hypnotherapy coaching programs for carers. As you can appreciate, that's a bit of a gobful, which is why we now call them building resilience and wellbeing programs for carers. And what do they do? You're thinking to yourself. So next slide, please, Steve. So we 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 run the resilience and wellbeing programs for 6 weeks in terms of duration. They're online, which means that anybody, that we've got no geographical restriction in terms of who can access the program. We have a maximum capacity of 8 carers, and they last on average around 90 minutes. Next slide, please. So I'm just going to run through what the program looks like. Now, when we're, I don't know, feeling burnt out, frustrated, annoyed, battle weary, often there's two sides to our. No, I'm not going to go on to the brain yet. So what happens is when we're in that mindset of, nothing's going right. So basically, what happens in our program is the first question we ask is, what's been good? Now, if I said to you, how are you? You would more than likely respond with, oh, I'm all right, or I'm all good, or everything's fine, or everything's great. But if I asked you the question, what's been good? Your brain has to go, regardless of what kind of day you're having, your brain has to go, your brain has to think about, okay, what's been good? So if you were to ask me that question about what's been good today, for example, I would say, well, I travelled to London and I've done some filming this morning. And now I'm sitting in the Hilton at King's Cross, because I knew I was going to deliver this webinar today and I could deliver it where I was doing the filming. So I'm sitting in a beautiful room in the Hilton delivering a webinar to you, beautiful people. So essentially, our brain has to switch to something positive. That's essentially why we ask what's been good. And as carers, generally, we feel, as I've already kind of shared with you, often we feel frustrated and annoyed and not being listened to. So when we ask, and we ask that question at the beginning of each week, and what we do is we encourage the carers that are in attendance to get to write a what's been, or get a book and write down every single day what's been good, so that they get into the habit and routine of going what's been good. And what we do each week is not only do we ask that question, but we'll then ask our carers to share about what's been good. So the brilliant thing about keeping a what's been good journal is that you don't then have to think back each week, oh, what's been good. Next slide, please. what does the 6-week program look like? So as I've already shared, the first question we ask is what's been good? Next slide, please. So the next thing that we move on to within our program is understanding how our brain works. So this is kind of where the coaching comes in. So yes, so Kerry and Dawn will explain, give a bit of brain education, essentially, is what happens next. Next slide, please. Why do we come back to brain revision every week? So obviously when we're learning, it's good to kind of go back over what we've learned. And often, every day for a carer is different. No 2 days are the same. In fact, in one day, Elijah could wake up and be feeling really happy, and then in the next moment he's having an epileptic seizure, and suddenly I'm having to run on adrenaline, or suddenly I'm having to think, right, do I need to call the doctor? Do I need to call an ambulance? If I call an ambulance, it's then what do we need to take with us to hospital? And I think when we're learning, it's really good to go back over what we've learned about the brain in the previous week. Next slide, please, Steve. So scaling and miracle question. So we asked the miracle question because it's there's something about, when Elijah became brain injured, I'm going to kind of just share a little bit of story here because I've got a bit of time. So, I could have quite easily have gone, that's my lot in life. That's it. He's brain injured. Nothing I could do about it. So I spent the first 3 months in an emotional. It was an emotional roller coaster, basically. I had loads of questions. I didn't know how this was going to pan out. Obviously, I was absolutely devastated and heartbroken at the fact that suddenly he was brain injured. Then, New Year's Eve, 31st of December 2007, I remember thinking to myself, well, in fact, I had a conversation with his neurosurgeon, and I basically said to him, I would not want to relive the last 3 months. But we're coming into 2008, and I've got to fix my boy. This was my mentality. So I went into this. Well, I became an avid researcher. Still am. 18 years on, and I had this old Dell reconditioned laptop, which served me well. So the miracle question is all about how happy are you on a scale of 1 to 10? So you might say to me, oh, I'm a 5. Then what we ask is, what do you need to do, or what circumstances what circumstances need to change in order for that number to change from a 5 to a 6? So then you have to think about, okay, so for example, if I'm going to take you back 15 years, I could have gone, if somebody had said to me on that particular New Year's Eve, how happy are you on a scale of 1 to 10, Caddy? I probably would have said 0. However, we're coming into a new year and I need to work on getting my young baby, as he was at the time, as well as I'm going to be able to. So it's all about, okay, I guess an element of being proactive, but also there's something about, um, you know, let's have it right. And I'm gonna, I'm not even gonna mind my P's and Q's. shit happens to us all. It's the reality of the situation, right? It's about, well, what do we do? We have to go through a period of, if say bereavement, for example, or Elijah becoming brain injured, or a social worker or healthcare professional not listening to us, or suddenly our loved ones end up in the hospital. We kind of have to go, okay, we have to journey through that. We have to kind of navigate through that experience and that situation and that circumstance. But then we have to go, okay, what do I need to do? What do I need to do, or what needs to change? If you're not happy in your job, for example, do you stay unhappy, or do you go, right, I'm not happy? So that might be talking to your line manager, or that might be, you know what, I've come to the end of the road in this particular position, or with this particular company, so I need to move out. So you have to take steps to change your circumstances. So that's partly why that's primarily why we ask the miracle, we do the scaling and the miracle question. And solution focused hypnotherapy essentially is, it's not about focusing on what's happened. It's not even thinking about what is my situation today. It's about it's about giving you the tools, or giving carers the tools, to be able to go, right, what is it what is it that I need to do to change that situation, or what is it that I need to do to change my mindset? Because there's kind of like a um, there's kind of, yeah, it's almost like a two-wing process. Elijah's brain injured, I can't do anything about that, but what I can do is make sure that he has the best life that he could possibly have. The fact that he's reached 18, when I was told that his life expectancy was between 2.5 to 5 years, I could have just gone, all right then, that's it, but I didn't. I got him rehabilitated. I sewed everything into him in terms of getting different therapists in to kind of help him recover as much as he could possibly do. And now, we've just recently celebrated his 18th birthday, and that's not because I've sat on my arse, as it were, and just accepted the situation. Anyway, next question, next question. Next slide, please, Steve. So, guided relaxation. They say listening to a guided relaxation is the equivalent of 4 hours of REM sleep. So we've taken the 8 carers through the different stages of the program, and we like to end with a guided relaxation, which is I can't really explain it. It's kind of like it's kind of like a relaxation. I'm going to use layman's terms. It's kind of like a relaxation process, if you like, um, with the therapist talking you through a story, essentially, but you're in a kind of relaxed state. Because as carers, generally speaking, our lives are full on, energetic. We often run on adrenaline. We work really hard for our loved ones, or on behalf of our loved ones. So having that time out uh, to kind of meditate and listen to somebody kind of essentially share a story is what that's about. Um, so that that is why, and what we've found so we've been running the Building Resilience and Wellbeing program now for 3 years. We've had 2 lots of lottery funding so far, which has been amazing. In fact, when we first got our first lot of lottery funding back in 2022, I was like, this is incredible. Um, And we've seen real transformative change in the lives of all the carers. So there's probably been about 50, 55 carers that we've taken through the process. And in fact, what I'm going to do, I am going to, because it just feels like this is a good thing to do. So I am just going to bear with me. Bear with me, bear with me. So I've got a little bit of time. Where is it? Just talk amongst yourselves.
Just to say, while Kadir is looking for what she's looking for, if people have got any questions, please feel free to put them in the chat box. Get them ready, and if you can press the raise hand symbol on the top of your screen, then I'll be coming round to you after Kadir's finished.
So I'm going to read this feels like a really nice fitting end to my presentation. I'm going to read you out a testimonial from a participant that joined our program a couple of programs ago. So I joined the Building Resilience and Wellbeing program after several years of struggling to cope with the responsibilities as a parent carer on top of everyday life and work. This program is different and more effective than any other counselling or therapy sessions that I've had because the steps are simple, logical, and I know how and why they work. I would definitely recommend the program to anyone who is juggling the stresses of modern day life with caring for a loved one. The theory on how the brain handles stress and the importance of regular but simple self-care procedures, self-care practices should be something that everyone learns. After the first session, I felt significantly lighter. Throughout the course, my self-esteem has improved. I am happier, feeling more capable and able to care for my children confidently. I'm even ready to return to work now that I have the toolkit to appropriately and effectively manage my stress levels. That is from Lucy. And that is the difference that I'm making with Carers Collective. Proactive, solution focused. It's also about carers. You can't put, what's the saying? You've got to put your own oxygen mask on first. You can't pour from an empty cup. You can't love, I don't believe, until you're able to love yourself. And when we're feeling well and less stressed, or when I know when I'm stressed and I'm angry and I'm tensed up, I'm like a grizzly bear. So but when carers have gone through this, it's recognizing, that we all need, whether we're carers or not, we all need to self-care, we all need to look after ourselves. So thank you for listening to me. I hope you've got something out of what I've shared with you today. And yeah, any questions?
Thanks, Kadi. Thank you for coming and sharing your powerful lived experience and hearing how remarkable you're doing with the program. And I think I always tell you this every time I speak to you to say I'm always inspired every time, you know, doesn't matter whether I hear it 5, 10 times, your story is just inspiring and hopefully not just myself and to be people on this webinar as well who probably feel the same way. I might have some questions, but just before I ask you, there might be people on the webinar who probably have some comments or questions they might like to ask. Uh, any questions for Kadi, please? Okay, Kate, I've seen you've put a question in the chat box. Kate says it sounds like a great program. Can it be shared accessed by other areas?
Yes. Um, we were going to deliver a program last week, next week, Monday. But what I've really found of late is that we've struggled to get bums on seat, as it were. But I would like, I'd love to share with you. I'd love to. Yeah, I mean, in terms of areas that we can go anywhere within the UK. Well, we could do, we could reach anybody worldwide. It's essentially, um, yeah, it's essentially.
Thanks, Caddy. Just to lead on from Kate's question, I'll probably just add on in terms of how carers can access the program in terms of registration. Is
Hmm.
there a link that you can share that people will be able to circulate within their networks?
Yes, yes.
Yeah, that's fine. You can either share it now, Caddy, or you can send it to me, and I'll be able to share it with the slides after the session or the recording as well.
What I would need to do is get another date. Basically, I have to before we yeah. Basically, what I have to do is check in with Kerry and Dawn when they're available, and then set a date up. But I could probably do that within the next week or so.
Yeah. There's a few comments. I don't know if you're seeing them in the chat box, Caddy. It's like one from
Okay,
Emma here,
I
which
suppose
says,
I've been able
I
to
work
help.
for a
Thank
carer
you.
services supporting unpaid carers, and your program would benefit our clients. So it's probably
Ah,
something to explore for ideas for you to explore there, Caddy. Um,
yeah.
and we also
Can
have
you?
Gary. Yeah, go on. We've got Lucy on the call. Lucy's just asking to say, is this available or suitable for young people?
I plan to develop a program or a similar program for young people. Yes.
Okay. In terms of age, what age group do you normally work with, Caddy, on the program?
I don't know if we've really got an age. I would say anybody from 18 upwards.
Okay.
But I think in terms of young carers, I think we would have to find a therapist that has experience of working with young people before we put a program together. But it's definitely something that I want to develop.
Okay. Any more?
Can we save the chat, Steve? Can the
Yeah,
chat
yeah.
be
That,
saved?
I'm recording the session as well, Caddy, and I'll be able to share it after the session, so you'll be able to see all the comments and everything, and that's in
Okay.
there. Yeah, and if there's
Oh,
any questions that you think you haven't answered properly, we can always go back to people afterwards.
yeah. So
Yeah.
it'd be good to connect with you, Emma, because it could be that we could develop or have a program just specifically for the unpaid carers that you work for.
Just another
Yes.
question there,
Okay.
Paddy,
Yeah.
probably from myself. I might have asked you this before to say what's the difference now in terms of the for you accessing local support since with Elijah compared to what it was like before and with all this knowledge that you have now, Caddy, what's the biggest difference that you see in local
Um,
services?
well, the whole personalisation agenda has changed over the years. I mean, obviously, you'll know, or we went from PCTs to then clinical commissioning groups to now ICBs. I have merged. Um, oh, thank you, Andy, for sharing my website. Um, I have merged. I haven't merged. North Somerset, Bristol, and South Gloucestershire have merged, obviously, so they're now one collective ICB. And what I've found in the just over 9 years of having, or 9 years of Elijah having a personal health budget, is what I could do in the early days of having a personal health budget and what I could do now is changed quite dramatically, is what I would say.
Yeah,
However, I really have a good relationship with, you know, I like to think that I have a really good relationship with, healthcare, social care. And I think it's all about how you communicate and how you build relationships with those individuals. As I kind of alluded to earlier on in my presentation, I used to shout, scream, and share. And the problem with that is that, a professional is just going to look at somebody doing behaving like that and go, well, what can I can't do anything for you when you're communicating in that way. So I've just learned to communicate a lot more articulately and a lot more calmer with professionals. And I think when you communicate your needs or the needs of your loved one in a calm and considered manner, then then professionals are so much more responsive to you. I'm not saying that they could go, oh yes, to your every kind of need or want, but they're more like, what I found actually is they're more likely to work with you in collaboration, in partnership for the good of you know your loved one.
yeah. Thanks, Cuddy. And talking of partnership, there is a question here from Peter, who's asked, do carers participate in the delivery of the program? So do you collaborate
Oh, that's
with
interesting.
unpaid carers in delivering your
That's an
program?
interesting question. Well, not yet, but it's something that we could think about and explore.
Any more questions? Let's have a look. Any more questions? Any hands that's been raised? No. Okay. So I was just going to say, Kade, in terms of people who might have questions or who might want to collaborate with you, who are on this call,
Yeah,
what's the best way to get in touch with you?
my email. Shall I type my email address in the what
Please.
chat?
Yes. Yeah. If you can put your email in the chat box, please.
I'm also on LinkedIn. There's my email address.
Oh,
I'll
thank you,
give,
Kade.
I'll give you my mobile as well. Oh, social fire.
Thank you. Do we have any last comments from people, please, for Kade, or any questions? Kadi has kindly put an email address in the chat box. So if you think of any questions or things that you might want to ask Kadi, please feel free to drop her an email. And Kadi, do you have
Yeah.
anything further to say just before we finish the session?
Thank you all for listening, is what I would like to say to you. And yeah, please connect with me. I'm on all the social media channels, LinkedIn, Facebook, Instagram. Well, I don't know if you NHS person. Well, you probably anyway. Yeah, I'm on all the social media channels. um, yeah, and I look forward to reaching to hearing from you. And thank you. Yeah, just thank you. Thank you for this opportunity, Steve. I was so excited when the fact that you've given me the opportunity. Thank you all for listening, and yeah, and I hope you all take away something that you've learnt, discovered from what I've shared with you.
No, thank you, Kadi. We do appreciate you taking time out from your busy schedule, and a very busy woman that you are to to come and share your lived experience and to share,
Yeah.
more about the program. So
Uh,
please do keep in touch with any developments regarding the program and anything that we can do to share from our end.
yeah.
And
Yeah.
I'm sure that's the same with everybody on the call who would like to connect with you. So yeah, please do stay in touch.
Will do.
And for people on the call, and probably for those who have team members who were not able to make the call, we've recorded the session, and the link will be shared probably later on today or tomorrow, along with the slides as well. So thank you all for coming, and we really appreciate you taking time from a busy schedules to join us on these webinars.
Thank
Uh,
you.
I've given you 8 minutes. You can have cups of teas and coffees before you start your next meetings. Have a good day, everybody.
Thank you.
Oh, I think, is there someone with a question? No, no, that's fine.
Oh.